patient and dental team considerations and instrument control. Okay, so this is a very important topic before starting with the clinical postings, and also when you start with your preclinical work, please remind all the points whichever we are learning today. Okay, so the topic consists of introduction, then patient position, chair position, operator position, and the assistant position. Okay, how illumination affects, then visibility illumination affects visibility and retraction, then various instrument grasps, rests, and fulcrums. So the practice of dentistry is very demanding and stressful. We all know we have to work in a very comprised and small area with a lot of concentration. So physical problems may arise of neck, back, and lower back, or shoulders, wrist, etc. if inappropriate positions are taken, or if they are continued for a longer period of time, then the dentist might suffer from various musculoskeletal diseases. Okay, so most restorative and the most restorative dental procedures are can be done while seated, but you have to interchange your positions, standing and sitting, for performing various procedures, so as to avoid various problems related to back. In any clinical procedure, it is necessary and important to ensure that the patient and the operator positions are properly selected. Okay, then again, assistant position is very important, because whatever instruments you have to exchange is through the assistant. Okay, so how the assistant is sitting, standing, or communicating is very important. Then your hand pieces and instruments also play a very important role in ergonomics. Now, ergonomics is what you have to pay proper attention to your posture. Okay, the dentist posture, the patient posture. Okay, then illumination, is the light proper or not? This is also very important when you work. If the light is not proper, it is very difficult to work in such environment. So coming to the first point of position, efficient patient and operator positions benefits for both the welfare of the patient and the dentist. If the patient is in a more comfortable position, when the patient is more relaxed during the treatment, he has less muscular tension, and he or she is more capable of cooperating. Okay, if the patient is not in a proper position, he might not cooperate with you for during the entire dental treatment. He might move here and there, and this might disturb you. Since we know that we have to work in a very small area, okay, the oral cavity, it's a very small area, and we have to work in the comprised area with our hands, it is very difficult that it is very important that the patient remains stable. So if the patient is in a comfortable position, you will be able to do the treatment properly. Okay, so by using proper operating positions and good posture, the operator experiences less physical strain and fatigue. Also, it reduces the possibility of musculoskeletal disorders, and it avoids unnecessary curvature of the spine or slumping of the shoulders. What happens when we practice dentistry for a longer period of time? We start experiencing pain in our neck or shoulder or wrists or hands or lower back. Okay, we do not take proper support, hence, and we have to work for a longer time just in a proper just that in a proper position. So if we do not use a proper position, we might experience all this ill effects of dentistry. Okay, so never use any uncomfortable or awkward position. Always balance and distribute your weight on both the feet. Okay, never let your feet hang. Always balance your weight on both the feet, and you can practice standing dentistry also. Okay, it is not necessary that you should sit and do your work. You can also practice standing dentistry. The main objective is to get proper access to the operating field. The visibility, comfort, and the patient safety is also at most important. Okay. So coming to the chair and patient position, what are the important considerations? The modern dental chairs are designed to provide the total body support. Now we have older chairs also, and we have the modern chairs also, the older chairs were not that supportive to the patient back. Okay, so now various chairs have come up, okay, to provide support to the dentist with the backrest, with the lumbar support. Okay, the stools are designed, the sally stools and the saddle stools have come up, which provide the spine with its original curvature. You don't have to slump your back, you don't have to hunch your back. Okay, so these are the modifications in the older and the newer chairs. Then the chair design and adjustment permit operator to give maximum access to the work area. Okay, chair design is very important. If you don't have a proper chair, you cannot get proper access to the patient's oral cavity. Okay, or the patient will not be comfortable, or either the dentist will not be comfortable. Okay, so your chair plays a very important role when you are working. Then adjust the headrest cushion. Now we have seen the various parts of the dental chair, I think in the last lecture or something. So the headrest, backrest, and the leg rest. Okay. So the headrest should be adjusted such that the head and chin are elevated slightly away from the chest. Okay. So there should not be any muscle strain to the patient. So the most common patient position for operative dentistry are the supine and the recline 45 degrees. You can see in the figure, this is the supine position and this is the recline 45 degrees. Both are recommended for sit down dentistry. Okay, that is the sitting dentistry. The use of the positions depends on the arch being operated. If you are working on the maxillary arch, mostly supine position is preferred. If you are working on the mandibular arch, then 45-degree recline position is preferred. The choice of the patient position varies with the operator, the type of procedure, and the area of mouth involved in the operation. The patient is positioned in a semi-supine or supine so that the operative field is over the operator's lap at the height of the operator's elbow. The patient may aid the operator by slight head rotation. You can ask the patient, suppose if you are working on the right maxillary tooth, so you can ask the patient to tilt his head on the right side and face towards you so that the operator gets more ease in working. The supine position enables the operator's forearms to be parallel to the floor when working in the operative field. Please try to understand like how you have to position. I have seen like students, they're going into the patient's mouth, they're leaning over the patient's mouth. That is not a good sign of operator. Always maintain some distance between the patient and yourself. Okay, there should be a distance of how much there is a distance while reading a book. Okay, never touch patient's head. Okay, try keep maintaining distance from the patient's head. When you are when you are positioning the patient in a supine, your lap should rest under the backrest of the chair. Okay, your lap should be under the backrest of the dental chair. Okay, then your elbow should be parallel. Okay, your elbow should be parallel to towards the dentist, toward the patient's shoulders. Okay, should be parallel to the dentist shoulder. It should not hang in air. In the almost supine position, the patient's head, knees, and feet are approximately at the same level. The patient's head should not be lower than the feet. When you are positioning the patient in a supine position, make sure that the head, knees, and feet are approximately at the same level, or you can place the head little above than the feet. Never place the patient's head below the feet of the patient. Only in emergency cases of syncope. What happens during syncope? The oxygen level to the blood is reduced. So you have to provide the blood flow towards the head. So in such cases, lower the head from the feet. Okay, lower the head from the feet. Only in such cases. Otherwise, you have to always place the head above the feet level. When the operation is completed, the chair should be placed in the upright position so that the patient can leave the chair easily and gracefully, preventing undue strain or loss of balance. Then this was about the patient position. Then coming to the operating positions now. Operating positions may be described by the location of the operator or by the location of the patient's arm in relation to the patient position. For a right hand, now please carefully listen to this, or you can also start reading from the screen. For a right-handed operator, there are essentially three positions: right front, right, and right rear. Okay, these are also referred to as 7 o'clock, 9 o'clock, and 11 o'clock positions, respectively. Getting right, front, right, and the right rear: 7 o'clock, 9 o'clock, and 11 o'clock. The usual chair position for the maxillary arch should not be used when adjusting casting or crowns. Okay, when the patient should be positioned in a more upright position when the patient's head is directed to the left or right, so that when you are trying a casting, or in simple words, when you are trying to cement a crown, never use the no, never supine the patient completely. Okay, tilt the head of the patient towards one side and don't recline completely. Okay, tilt the head towards one side, so that even if your crown falls sometimes, it will fall into the buccal vestibule and not directly into the esophagus of the patient. Okay, it will not go directly inside. For the left-handed operator, the three positions are left front, left, and left rear, or 5 o'clock, 3 o'clock, or 1 o'clock positions, respectively. The fourth Sorry. The fourth position, direct rear or 12 o'clock position, has application for certain areas of the mouth. As a rule, the teeth being treated should be at the same level as the operator's elbow. Getting the operator's elbow should be at the same level of the tooth being treated. Okay, remember this small points. Okay, usually 11 o'clock position is used for all the procedures. Okay, and rarely 12 o'clock position is used. Now coming to the zones, there are four major zones of activity around the operative field: the operator zone, the transfer zone, the assistant zone, and the static zone. Okay, now consider this is the operator stool, this is the dental chair. Okay, this is the 9 o'clock position, 11 o'clock position, 12 o'clock position. Okay, and here it is 1 o'clock, 3 o'clock, and 5 o'clock for left-handed operators. Okay, 7, 9, 11, 12. Now, 11 o'clock position, this position is considered the most universal operating position because it provides access to all the areas of the tooth. Okay, except now where you should not use, or where it is difficult to use 11 o'clock position in the mouth, it is in the more distal areas of the mandibular right quadrant. Okay, mandibular right quadrant is 4-7 or 4-8. When you're working on 4-7 and 4-8 tooth, then this 11 o'clock position is little difficult to access. The cervical areas on the patient's right posterior quadrant. Okay, 9 o'clock or 7 o'clock position. This 9 o'clock or 7 o'clock position is an alternate position for the mandibular right posterior quadrant, and it usually is used in conjunction with a mirror to reflect the light. Okay, you can also use it in indirect vision. The 7 o'clock position is usually used for mandibular anterior teeth, mandibular posterior teeth on the right side, and maxillary anterior teeth. So for 7 o'clock position is used for mandibular anterior teeth and maxillary anterior teeth, usually on the buccal surface, okay, or the facial surface. 7 o'clock position is used. 9 o'clock is convenient for operating on the facial surfaces of the maxillary and the mandibular right posterior teeth, and the occlusal surface of the mandibular right posterior teeth. Okay. Then 12 o'clock is utilized for the maxillary and mandibular anterior segments lingually, when you are working on the lingual side, or when you are doing an access opening on the mandibular or maxillary teeth, your 12 o'clock position is used. A common fault in operating at this position is to use direct vision. Never use a direct vision when you are performing or when you are working in the maxillary arch. When you try to twist your head, okay, when you are using a direct vision, you will get a neck strain. Not really soon, but in later future you will definitely get an neck strain. always try to start working on indirect vision. Okay, see, it's right front, right and right rear and direct positions. Okay, like this is the right rear, 11 o'clock position, 12 o'clock position, 9 o'clock position, and 7 o'clock position. You can see from the hands, you can make out where the operator is. The transfer zone is located near the oral care. Now, what is transfer zone? Transfer zone is the area from where the instruments are exchanged from the assistant to the dentist. Okay, so this is located near the oral cavity where the instruments and materials are transferred between the operator and the assistant. The assistant zone allows the assistant to access to both transfer zone and the static zone. The assistant working from the 3 o'clock position does not change position relative to. So now we being dentists, we have to change our positions with respect to the working tooth. Okay, but the operator, he doesn't have to change his position. His position will be between the static zone and the transfer zone, usually in 3 o'clock position. Okay, the static zone is which has no traffic flow. It contains auxiliary equipment. The instruments which are not needed during the positions are procedure are kept in the static zone. Okay. See, static zone, assistant zone, where the assistant is sitting, and this is the transfer zone from where the instruments will be transferred to the dentist, and this is the dentist zone. Getting here the static zone, you can see where the auxiliary instruments are placed. Same with the left hand operator. The desirable The desirable posture position for the operator is one in which the operator is seated well back on the stool with the feet flat on the floors, legs relaxed and relatively together, and thighs parallel to the floor. You can see this is the incorrect posture and this is the correct posture. How the patient is how the dentist is hunching his back over the patient mouth. Keep safe distance, okay? With proper light, adjust the lights properly so that the shadow of the light doesn't fall while you're working, or don't interrupt the light with your own head, okay? See, check the patient position, check the operator position, never lean your back. This will lead to back pain and neck strain and shoulder pain, okay? Keep your thighs also parallel to the floor. Okay. The face of the operator should not come in close proximity of the patient. I've already told you about this. The ideal distance is similar to that for reading a book, should be maintained. Maintaining an appropriate working distance from the patient is important for the operator to master in early stages of learning. This is your basic stage of learning. You are entering in the field of dentistry where you have to work for another 50 to 60 years. Okay, might be more than that, but if you don't practice dentistry properly from now, you will be continuing the same throughout your life. Okay, so always keep maintaining proper distance whenever you are working. The patient's chest should not be used as an instrument tray. I've seen most of the students, they keep their instruments on the patient's chest. Never do that. This is a very, very wrong practice. Okay. Unnecessary contact is unpleasant to many patients and should not be practiced. Okay. Many patients might take objection, and that is a very wrong thing when you do that. Always try keeping your instruments on the patient's on the chair. Okay. Provided on the tray, provided on the dental chair. See how is the operator, how they are maintaining the distance from the patient and the operator. Then the instrument exchange, all the instrument exchange between the operator and the assistants occur in the exchange zone below the patient's chin. Okay, never exchange the instruments from over the patient's head. Okay, always you exchange the instruments below the chin and several inches above the patient's chest. Instruments should not be exchanged over the patient's face. During the procedure, the operator should anticipate and inform the assistant of the neck. Okay, always try to train your assistant. Okay, what do you want next when you are working? Suppose on a class 1 cavity, and you have prepared the cavity already. Now you need now you have to do the base filling. Ask the patient to keep ready the cement, to mix the cement, okay? And after that, ask the patient to mix amalgam, okay? So keep training your assistant. Illumination and visibility. Illumination of the operating field can be achieved through overhead lights or lights attached to the instrument. Many instruments are coming now with handpieces. Such as the lights itself is incorporated into the handpiece. Okay, so that provides a very good illumination in the field of oral cavity. The overhead light should be positioned so that the light rays will travel unobstructed to the area. I've already told about this. There are certain rules for intraoral viewing. Ideal viewing occurs when the lights come directly from its source to the operating field, which is being viewed directly. Every effort should be made to establish this arrangement. In areas where the overhead light is obstructed by certain immovable anatomy, the hand mirror should be used to reflect some of the overhead light on the unilluminated area. Direct vision can still be used. Whenever possible, direct vision with direct illumination from the dental light is the most desirable. If this is not, see, this is direct vision and this is indirect vision. Can you see the patient is working on the mandibular anterior teeth, and on the lower side, he is using this mirror to reflect the light, and he is using this indirect vision. He is not peeping into the patient's mouth directly. Okay, so he's using the mirror. This is indirect vision and this is direct vision. So mouth mirror here is used for retracting the tongue. See, indirect illumination. Can you see the mouth mirror is used for illumination here, here. 16 to 18 inches is regarded as an optimal eye to work distance. So there should be at least 16 to 18 inches gap between you and the patient. You can also ask the patient to turn your head towards your side, to turn his or her head towards the dentist side. Now, the operatory light should be positioned at the arm's length from the operator. Okay, arm's length should be at this height from the operator. Never place it too below, otherwise your head, the operator's head will touch to the light and interferes it. Okay, having the light closer to the operative field does not appreciably increase the light intensity. If you think that if you place the light too close to the patient, you will get a wide illumination. That is not the case. Okay, the light has that much power. You place it at a height above your above the operator's arm's length. Okay, also if you place too closely it might hamper, okay, the patient will not be comfortable because the light will directly hit on the patient's eye. So never place the lights very close to the patient. See, this is the picture I showed you previously also. Now, this is magnification. The another key to the successful success of clinical operative dentistry is the visual acuity. Now, various modern equipments like the dental operating microscopes, the loupes, magnifying lenses, surgical telescopes have also come up. You can also use these loupes to increase your magnification. Then retraction with mouth mirror or any other instrument, it provides visibility, accessibility and illumination. You should always use retraction when needed, never work hazily. Okay, depending on the locations of the area. Usually when working in the mandibular area, tongue is a major hindrance, so you might get distracted by the movement of the patient's tongue. So always retract the tongue with proper instruments. Mirror may be used for retraction of cheeks or tongue. Okay. See how the tongue is retracted, how the buccal cheek is retracted while working on the maxillary. Now, control of the operative instruments. I think we have to stop here now. Okay, there are various grasps we have to cover. We'll continue for another 2 minutes. Okay. Control of operative instruments. Besides instrument control is important during the operative procedure. The manner in which the hand or rotary instrument is held. Okay. Proper grip is also very important when you are working. If you are not giving proper support to your fingers or arms, then it might also cause pain in your wrist. Okay, have you heard about carpal tunnel syndrome? It is a disorder of the wrist where you cannot move your fingers or your hands. Okay, you cannot grip any instrument. So it is a disease or disorder which affects your entire palm. Okay, so please Remember all these points. Give proper support to your fingers while operating. Okay, give proper rest to your fingers for successful dental treatment and for successful life also, I can say. Okay, now the proper grasp are the pen grasp, the modified pen grasp, the inverted pen grasp, the palm and the thumb grasp. Okay, selection and application of the correct grasp relates to the position of the operator, the quadrant being operated, and the specific procedure to be performed. This is the normal pen grasp. The upper part of the first finger at the side of the knuckle, upper part of the first finger at the side of the knuckle is a firm bearing point for the reverse end of the handle. The cushion of the third finger, you can see here, the cushion of the third finger provides a rest. This is the firm grip here, and this is the rest. See, this is the modified pen grasp. Now, can you see the difference? This is the pen grasp, and this is the modified pen grasp. Okay, you can see how when you are working on the molar tooth, you are giving a proper rest. See the rest how. So this way, the rest provided by the middle finger here, the rest provided by the ring finger here, and the rest provided by the other hand. Okay, these are the four different types of rest. Modified pen grasp. See the modified pen grasp. This is such a big rest provided by the third finger. Okay, and the ring finger also. This is the inverted pen grasp. Usually we do not use